An article in the View issue on how the community in Northern Ireland responded to the COVID-19 pandemic attracted a lot of attention from readers. It looked at how a women's refuge in South Belfast coped with the effects of the pandemic and the sharp increase in domestic violence. View editor Brian Pelan spoke to refuge worker Diane Hickey to hear at first hand how they coped with the lockdown.
Well, COVID-19 impacted greatly in women and children living in refuge. One of the key factors in domestic abuse and domestic violence is when the abusive partner isolates the woman and children from family and friends. So we had to deal with a lot of backlog, I suppose, of domestic violence, issues coming up, historical stuff that had come up that women had already dealt with and that we had already worked through with women. So it was after the lockdown was sort of lifted, then we would have had an influx of women and children coming to refuge that were able then to escape.
What was the community spirit like in the refuge?
The community spirit was amazing. Women really pulled together despite their emotional trauma and what they were dealing with themselves.
What sort of outreach services did you provide to women?
We have a vast outreach service, so between ourselves and refuge and our outreach team here in Adelaide Park, we pulled together and we got funding for women who maybe weren't able to get out the same to be able to get their shopping. So we were able to seek funding, secure that funding, go and get some shopping for them and deliver bags out into the community.
Are you optimistic or pessimistic about the future in terms of how you cope with the pandemic, especially if there's a second wave?
I think Belfast and Lisburn Women's Aid put a fantastic resources in and health and safety measures in to be able to cope with the pandemic. So should the second wave come, we're prepared physically in terms of health and safety, but also emotionally. I think we're ready now for women and children because we know that isolation is very difficult. So I think we'd be better prepared for that.